Hello, my friends. I'm Dr. Nerita, a urologist and men's health specialist with more than 12 years of experience helping men safeguard not only their physical health, but also their confidence, dignity, emotional wellness, and the relationships that matter most. Today, I want to have one of the most honest, open, and even slightly uncomfortable conversations you'll probably hear online. It's a question men whisper privately, Google late at night, or bring up nervously during appointments. The kind of question that reveals how deeply men care about intimacy, safety, and their partners. That question is it safe to swallow vaginal fluids during oral intimacy? And right behind that question come three others. Most men are afraid to voice. Is the taste normal? Is the smell normal? Is something wrong with my partner or with me? Gentlemen, this space right here is a safe, respectful environment. No shame, no judgment, just real information rooted in medicine, biology, psychology, and lived experience with thousands of men and couples. Before we dive in, tell me in the comments, where are you watching from today? I love seeing this global community of men learning together with respect and maturity. And if you're new here, make sure to subscribe. Your health, confidence, and relationships truly deserve clear science-based answers. Section 1, the first truth men need to hear. Let's begin with something absolutely essential. Vaginal fluids are not dirty, toxic, or shameful. Healthy vaginal lubrication is the body's natural mechanism for protection and comfort. It's designed with purpose, not by accident. Yet many men carry hidden fears. What if it's unsafe? What if the taste changes? What if I notice an unusual scent? What if something's wrong? Here's the truth. Variation is normal. Health is possible. Communication is everything. Once you understand how the female body actually works, most of the anxiety evaporates, and intimacy becomes deeper, gentler, and more emotionally connected. As a urologist, I've talked with men in every stage of life, divorced men rediscovering intimacy, couples married 30 plus years trying to rekindle closeness, men in their 60s and 70s navigating new relationships, younger men afraid of doing something wrong. Across every age, culture, and background, the same themes arise. Men fear awkwardness. Men fear harming their partner. Men fear being judged. But when men finally understand vaginal fluid from a scientific, respectful standpoint, shame dissolves, confidence grows, and intimacy transforms. Section 2, the 5 big misunderstandings men have. Let's break down the 5 biggest misconceptions, rewritten, expanded, and explained with clarity. Misunderstanding 5, thinking vaginal fluids are just moisture. This couldn't be further from the truth. Vaginal lubrication is an engineering masterpiece created by the female body. 3 major sources contribute. 1. Bartholin's glands, located near the vaginal opening. They release a smooth, slippery fluid that reduces friction. 2. Skene's glands, located near the urethra. These glands contribute to lubrication and sometimes fluid release during intense arousal. 3. Cervical glands. They produce protective mucus. Even post-menopause, they contribute to natural moisture and pH balance. Put together, this isn't random. It's a system built for comfort, safety, and pleasure. To misunderstand this is to miss how brilliant the female body truly is. Misunderstanding 4. Thinking taste and scent must always be the same. This is where many men panic silently. But listen carefully. Taste and smell naturally vary, and variation is normal. Many factors influence this. Hydration, diet, stress levels, hormones, medications, menstrual cycle phases, menopause. None of these changes mean anything is wrong. They reflect the dynamic reality of biology. Here are normal variations. Hydrated plus fruit-rich diet, milder, lighter, sometimes slightly sweet. Scent, around ovulation, more lubrication, very neutral or slightly sweet, near menstruation. Subtle metallic hints are normal, post-menopause, slightly more acidic or less lubrication. When is concern warranted? Sharp foul odor, gray, green, or frothy discharge, itching, burning, pain. These signs usually point to a simple, easily treatable imbalance. Nothing to be ashamed of. Misunderstanding 3, assuming it's always safe no matter what. Most of the time, yes, vaginal fluid is safe, but like semen, saliva, or blood, vaginal fluid can carry infections if one partner is infected. These include chlamydia, gonorrhea, trichomoniasis, herpes, HPV, HIV. Does that mean the risk is high? No, most oral to genital risks are low, but low risk isn't zero risk. That's why understanding health status matters. Testing isn't a mood killer, it's a trust builder. Misunderstanding 2, thinking testing is awkward or unnecessary. One of the biggest sources of anxiety in my office is uncertainty. I had a patient in his 60 seconds once who panicked after oral intimacy with a new partner because he had bleeding gums. He worried intensely about HIV and could barely sleep when he and his pa. RTN are tested together. They discovered both were completely negative, and the act of doing it together brought them closer and more honest than ever. Testing is not unromantic. Testing is maturity. Testing is respect. Make it a twice yearly ritual. Your partner will appreciate your thoughtfulness and responsibility. Misunderstanding 1, responding with embarrassment or criticism. This is the most damaging misunderstanding of all. When a man reacts with a joke, a grimace, a negative comment, he unintentionally creates a wound in the relationship. Women are sensitive to rejection around intimacy. Harsh reactions create lasting emotional shutdown. The opposite, kindness, gentleness, acceptance, deepens trust instantly. If something tastes stronger than usual, say, hey, want to freshen up together, or how about we shower together first? Respect transforms everything. Comfort builds connection. Acceptance ignites attraction. Section 3, is it safe to swallow vaginal fluids? Here's the clear medical answer. For healthy, infection-free partners, yes. It is generally safe. For partners with unknown health status, risk is low but not zero. For partners with known infections, precautions are recommended. No shame, no fear, just knowledge. Vaginal fluid mainly contains water, amino acids, sugars, enzymes, natural protective acids, good bacteria. These elements are designed to maintain health, not harm it. The female body knows exactly what it's doing. Section 4, how to make intimacy safer, healthier, and more connected. 1, talk openly. Normalize conversations about scent, taste, health, and comfort. 2, get tested together. Make it a twice yearly ritual of trust. 3, support hygiene gently. Hydration, balanced diet, and shared showers are wonderful. 4, be compassionate. Variations are normal. Your acceptance builds her confidence. 5, remember what intimacy truly means. Intimacy is not technique, it's emotional safety. It's trust, it's compassion, it's connection. For many women, feeling accept. Ed is more intimate than anything else. Section 5, the heart of the message. Gentlemen, let me tell you something from years of guiding men through this topic. You are not too old for passion. You are not too old for pleasure. You are not too old for connection. Intimacy does not fade because of age. It fades because of silence, shame, or misunderstanding. This topic becomes simple and safe once we talk about it openly. You are not alone. Thousands of men have asked the same question. Quietly, nervously, privately. Asking does not make you weak. Asking makes you wise. And once you understand the science and communicate with respect, intimacy becomes freer, safer, more joyful, more connected for both partners. Final message. So, is it safe to swallow vaginal fluids in healthy couples? Yes. Is variation normal? Absolutely. Is communication the real secret? Without question. If this conversation helped you, give this video a like so more men can learn without shame. Subscribe for weekly men's health guidance and tell me in the comments, where are you watching from today? Remember, friends, your health builds your confidence deepens your connection. And intimacy, when handled with maturity, has no age limit. I'm Dr. Nerita. Take care of yourself and the people you love. I'll see you in the next video.